Hi there, and welcome to episode 25 of the ADHD Adults podcast. I'm James Brown, co-founder of ADHD Adult UK, and as usual, I'm joined by... This is going to be difficult, actually. This is going to make sense in a few minutes. I'm joined by my good friend, the lovely and very intelligent Dr. Alex Connor. Hi, Alex.
Cowabunga, dude.
That's fine. That's fine. That doesn't ruin everything. It's fine. How are you, Alex?
I'm very well, thank you, James. Good to see you. I'm very, very happy. We're still going up with numbers. I cannot comprehend it. I've been sent a letter from a Robert from Kidderminster, James.
Good. Before we go into that, I'd like to say that I'd like to say hello to our listener in Moldova. Believe it or not, Alex, we have one. I was looking through our stats the other day, so hello to our listener in Moldova. I never thought I'd say
hello in Moldova.
Words. Yeah. Anyway,
I like that.
Let's get back.
So I've been sent a letter, James, from a Robert from Kidderminster. It says, "I'm proud of you, son."
Oh,
I'm not. I'm going to read a real email because that was obviously a lie. I'm going to read an email from a listener who we won't name. Hi guys, loving the podcast. Learning about my ADHD really helps me to understand myself and why I felt so useless for so long. I'd prefer if you weren't so mean to each other. I'm sure you're both lovely. So we decided.
Actually, you decided, Alex, if we're going to be.
We decided that we're going to be nice to each other and give it a go for one episode. One episode where Dr. James Brown has to say nice things about me. So, James, over to you, James.
This is going to be the most difficult challenge I've ever faced in my life, professional or otherwise. But I promise I'll try, Alex. That's all I can do. So, as usual, this lovely, happy, well-produced and professional podcast is a tragedy in 3 parts. We choose a theme. In the last episode, we talked about the question, is ADHD real? And about the stigma and misinformation about ADHD. And in this episode, we're talking about the link between ADHD and mood disorders. Right now, my mood is happy, full of flowers, and definitely not dominated by anything negative about my colleague, friend, and better, it says in the script, Dr. Alex Connor. Oh, God, this is hard already. I'm struggling already, mate. The three parts include some evidence-based psychoeducation, which the lovely and not at all spherical-headed Dr. Alex Connor will deliver. Normal-headed Alex Connor will deliver some personal reflections on ADHD and mood disorders, and as usual, it's something that is an issue for me, so there'll be a lot from me in that section, and we'll give you some tips, is probably an inappropriate word, but we'll talk about things that might help you if this is an issue. So Alex, the lovely psychoeducation monkey, tell us in your dulcet, soft, velvety voice about ADHD and mood disorders.
I'm loving this one. Right. The reason we're talking about this is there is a lot of overlap between ADHD and mood disorders. The most common type of mood disorders are major depression, dysthymia, which means long-term and low mood, and bipolar disorder, which you may have heard referred to back in the day as manic depression.
Can I just say that's a brilliant start, Alex? Very well delivered, professional.
That's sarcasm. That's insincere, James. Remember the rules.
I was honestly just reflecting on how well you delivered that, and I'd like to repeat, well done, Al.
Mm-hmm. Right. It's important to note that for some people, depression and ADHD coexist, 2 separate disorders. But for others, depression is a direct result of the ADHD, with low self-esteem, poor self-image, caused by ongoing feelings of being overwhelmed by life. And that is due to the ADHD symptoms. It's very hard to know the difference. I know you love your stats, James. So looking at some statistics, this is from one massive American study, but it's quite a big one, and there are other things. But it's broadly accurate, we think, from our little readings, which is to have a coexisting condition of any old mood disorder is about 11%. for adults without ADHD. When you've got ADHD as an adult, that goes up to a whopping 38.3%. So if you're talking about major depressive disorder without ADHD, about 8%, nearly 19% for us lot. The dysthymia, which is that mild chronic depression, is just under 2% of the, in brackets, normal population, the non-ADHD population. 2%. Going up to just above 12, that's 6 times for adults with ADHD. And bipolar disorder goes from 3 and a bit percent up past 19%. These are huge increases.
They are. Bipolar's of interest to me. I'm actually waiting for a diagnosis of bipolar. Actually, before I got my diagnosis of ADHD, and we chatted about this in the past, both personally and on the podcast, about how both kind of came together at the same time, and I realized there were issues that needed to be sorted. But the reason bipolar interests me is it's difficult to get a diagnosis of bipolar disorder, especially if you already have a diagnosis of ADHD. And that's largely because ADHD is often associated with what we call rapidly cycling moods, or a little bit of mood instability. And it's also important to clarify, I think, that bipolar disorder is kind of a catch-all name for a collection of mood disorders. Bipolar 1, which, when we were growing up, which wasn't long ago because you're very young, Alex, obviously, was often called manic depression. And that is, classically the more severe form of the disorder. But there is also bipolar 2, which is slightly less severe, which is associated with hypomania as opposed to mania or manic episodes. And then cyclothymia, which is really rapidly cycling moods. And they all fall under this umbrella of bipolar disorder.
That's all very true, James. And thank you for interrupting me without insulting me. I think I could get used to this. Shall we do it every week? Right. Okay. So I know we're talking about some serious things here. So we're trying to. The issue we have is that lots of the depressive and manic symptoms, even of bipolar disorder, either of them, it looks like ADHD. These resemble ADHD symptoms, and sometimes it's hard to tell the difference for anyone. This isn't a problem with the medical profession. It's a problem with humans and psychology. So it does mean that it's sometimes hard to get a bipolar diagnosis. In the UK, for example, the average bipolar patient, regardless of whether they're ADHD or not, takes about 10 years nearly to get diagnosed. And they're misdiagnosed on average 3.5 times.
Oh, no, sorry. I'm going to stop.
What were you going to say? What were you going to say? I've been what?
Nothing.
Okay. The reason we're talking about this, James, positive James, is that it's very clear and massive klaxon warning. James, are you happy with how I pronounce klaxon? Klaxon. I don't
mind. I don't mind, Al.
So the klaxon trigger warning is because we need to discuss how serious this is. Awooga! James?
Come on, you're pushing me. You're in a very delightful way pushing my buttons now, Alex. But thank you for doing that. I appreciate you.
The actual klaxon. So the reason we're talking about it, and the reason for the klaxon, is that undiagnosed or untreated bipolar disorder, this can be deadly. 1 in 5 people with that condition will commit suicide. Studies show that around 1 in 2 will attempt suicide. The rate is around that. The rate of that is around 15 times higher than the suicide rate in general. And we have to talk about it. The other mood disorders we've talked about, major depression, dysthymia. I wanted to call it dysthemia because I know that would annoy you. Dysthymia, these are just as debilitating episodes of major depressive disorder when it occurs with ADHD. Last longer, and they're more likely to result in suicidal behaviors, more likely to result in hospitalizations, more likely to convert from unipolar to a bipolar mood disorders. Oh, God, I'm really sorry, but this is something we need to talk about, and that's why we're talking about this today.
It is. I do feel there is an element of goading in that last paragraph, though. where you've got to be nice to me as well, Alex. I know this is great fun for you, isn't it? But
It
don't
was
enjoy it.
goading, that's true.
This podcast will end. I'll let you know at some
Yeah,
point.
it will, yeah.
No, but thanks for that. It's important to me, and I think it's important to a lot of our listeners. We'll talk a little bit about support later. But for now, I need to go into a break, largely because this is the longest I've ever been nice to Alex. And if you're watching on YouTube, you'll see how physically difficult it's been for me. And Alex has got a massive picture of me behind him.
That's my background. It's one from my personal stash, this, James.
Which is, he's been looking forward to this now for a while. So we will see you in part 2.
Hello and welcome back to episode 25 of the ADHD Adult UK podcast, where we are talking about the coexisting conditions of mood disorders with adult ADHD. As always, the second bit of our podcast, we're talking about personal reflections of the theme or of the topic. It's a bit serious, a bit uncomfortable, but the good thing is that James and I are being nice to each other for this difficult and only this episode. So James, personal reflections.
Thank you for that introduction, Alex. Yeah,
I've
had thank you for making me welcome. I've had years and years and years of mood disorders. Well before I knew I had ADHD, I knew I had what I thought was depression. In my early 20s, I was on antidepressants, on 4 or 5 different antidepressants, being on antidepressants on and off during periods of life. And the way in which I described it, and I think I've said this to you before, I may have said it on the podcast. The odd thing was I didn't know much about bipolar, and I just assumed that sometimes I got depressed, and very depressed, not kind of the dysthymic chronic low mood, feeling negative about life, but full on I hate myself and I don't want to be here depressed. But the interesting thing was, for years I knew that actually the reality was that the way I describe it is there was a thin membrane between me being absolutely normal and functional as I get, and being in utter despair. And, I don't want to be here anymore. I am, people will be better off without me. And then really quickly I would go back to just being normal. And for years, I just thought, well, that's obviously my form of depression. Is I have these periods of a couple of weeks, sometimes more, sometimes less, where my mood is, seriously low, and I have very dark thoughts. But I didn't really know anything about bipolar. Now, around the time that I first spoke to you about the fact that I was in a mental health crisis, and you said, listen, you've got to get your ADHD diagnosis, I started watching the television program Brassic. I don't know if you've seen it, because whilst you have a wonderful taste in things, Alex, I'm not sure if popular television is within your kind of sphere of culture. But try it, because you've got great taste.
No, I haven't.
And I'm sure Brassic, which was written by and stars Joe Gilgan, one of my favorite actors. The lead character has bipolar, and it was a genuine light bulb moment that I saw how this character was portrayed, and I thought, hang on a minute, what is bipolar? And I looked it up, and everything made sense. I think
we get a lot of. Sorry, James. We get a lot of feedback, don't we, from people listening to this podcast that the same things happened to them about ADHD. Yeah. Was it like that?
It was more so than ADHD, because my ADHD symptoms had only really been a problem for about a year through lockdown, but my symptoms of possible bipolar had been a problem for 30 years. How old am I? 25 years, maybe. And all of a sudden it made sense.
You're very young.
I'm so young. It made sense that I wasn't always depressed and didn't need antidepressants, but I had these short periods which I often couldn't predict. There often wasn't a trigger. It would just happen. All of a sudden, the slightest bit of pressure like that, and I would break through that membrane and be desolate. What I hadn't noticed, because they're more subtle than you might think, is I also was having hypomanic episodes. That would include risky behaviors of a number of different incriminating type, so I'm not going to.
James, sorry, this isn't being critical because I'm not allowed to, but are you suggesting you think your hypomanic episodes are subtle?
Well, they are.
They're not subtle to me.
And they're not subtle to you, but I think when you grow up watching film and television portrayals of what was called manic depression and is now called bipolar, when people have psychotic breaks and get institutionalized for 6 months because of a manic episode, hypomania is more subtle than that. But now, so immediately I started keeping a mood diary and started recording my mood every day on a scale of 0 to 10, 0 being obviously the world's ended and 10 being, I am full on in mania. And over a period of even the first couple of months, it was obvious that there was a pattern of mood instability where I could have 2 weeks of very low mood, which would culminate in trigger warning, in suicidal ideation. But then 3 weeks later, I'd have 4 days where I wouldn't sleep. I would, again, he says, try not to incriminate himself, engage in risky activity of a number of different types, and have so much, it's really hard to describe, have so much energy that I could put my fist through a wall, not in an aggressive way, but I couldn't get rid of that energy. And I can remember in one of these bouts of hypomania, lying on the sofa and thrashing my legs, kicking my legs as hard as I could, so they were going 2 or 3 feet in the air for 20 minutes, just trying to get rid of this urge to do something, this need to get rid of all this incredible energy. And it was only really then that I started to look back at periods of my life and think, this isn't the first time this has happened. This has been happening for a long time. So that's when I sought a diagnosis at the same time as ADHD. Now, because I went private for my ADHD diagnosis, but went through the NHS for bipolar, even though it followed a period of suicidal ideation, so it was a quick referral because it went through the crisis team. It was a really frustrating experience. I got to speak to a psychiatrist. The psychiatrist put me on a drug called quetiapine, which is commonly used to treat bipolar, but on a dose that was so low, it was sub-therapeutic, and then just left me. So didn't tell me I had bipolar or not, but gave me a drug that's used to treat bipolar at a dose that isn't effective for bipolar. So I took it for, you'll remember this, I took it for a month and obviously didn't do anything. And then I took it for another month and then thought, oh, hang on, what's going on? Phoned at my GP and said, can I change the dose? And he said, no, we can't touch it. It's the psychiatrist has got to. And I said, well, what's happening next? Am I seeing the psychiatrist? Am I bipolar? Yeah. And he said, well, I'll write them a letter. Now, by this point, I'd got my ADHD diagnosis. And the doctor, as they do, wrote to the psychiatrist or the psychiatric team saying, I'm writing on behalf of this gentleman who has recently been diagnosed with ADHD. And immediately I was discharged from the psychiatrist who said, oh, he's just got ADHD then. And that was that. It was over. There was no consultation.
Did they use the word gentleman?
Yes, they did.
Which I would fully agree with and support.
Thank you for that. That caveat's got you out of trouble there. So well done. Congratulations for adding it, Alex.
Thank you.
That was it. They did. There was no consultation. There was no meeting. It was just, you are discharged. Don't bother taking the tablets anymore. Off the
books, right?
Yeah, off the books. Exactly. Now, when I was diagnosed with ADHD, I told my ADHD psychiatrist about this, and he said, understandably, because he didn't have any evidence, well, it's probably just your ADHD. But when I had my discharge appointment, I said, I'm going to send you my mood diary. And I sent it through. And in my discharge letter, it said this gentleman also needs to be assessed for bipolar. And I think it was clear from that he felt that needed to happen. So I've now got an assessment. It's actually in the next 2 weeks after I had a mental health crisis 2 months ago, and that led to me really thinking, I've got to get this sorted. I'm getting closer and closer to doing something final, and that scared me a bit. So I thought I've got to press for this, and I've had now 2 assessments with psychiatric nurses, and now it's finally got to the point where a psychiatrist is going to meet with me, and I'm going to show them my mood diary, and I genuinely hope that I get my diagnosis. This shouldn't have happened. And believe me, it happens to many other people. I've got personal experience of some of the first people I spoke to when we set this group up, who are exactly like me. And we've talked about this. It shouldn't happen. And actually, Alex, actually swearing's allowed because it's not swearing at you. I'm fucking angry that I've had to go through this. I'm angry that other people have to go through this. That because of this inflexibility, and I get it. It's difficult, because there is crossover, but it's just so diminishing and dangerous to say to someone, no, that's just your ADHD. And for me, it's been 18 months in which I have come closer to, like I say, doing something final than I ever want to again. And that maybe could have been stopped if I'd been diagnosed earlier. This is a cheery podcast, isn't it?
It is. I tell you what, James, it's diminishing and dangerous for you. It's diminishing and dangerous to underfund our fucking NHS as well, isn't it? And sometimes we're critical of medical health, but not in this case. It's because they've been defunded by stealth, and it's really, really pissing us off.
It is. I mean, if anyone out there has been exposed to child and adolescent mental health services or has children that has, they will just tell you how bad the situation is. Even in crisis, you often don't get help. And again, we are not criticizing the NHS.
No, they'll tell you. The clinicians will tell us.
Yeah, we're criticizing the people that have defunded it. I could go on for ages, but I don't think you could carry on being nice to me because you get bored. So I will stop there, Alex, and ask you, what about your personal reflections on kind of ADHD and mood?
You're shorter, really, James. Thanks, though. Yes, it's hard to follow that. Mine, as you know, my mood is wild. I work hard on peaceful wildness. James, peaceful wildness.
You are. I'm at the limit. I'm at the limit. I will accept that, Alex. Peaceful wildness. Yes, that sounds interesting.
Yeah, so I did think I was bipolar. It's never been diagnosed. I suspect it probably isn't. Many of us get diagnosed with stuff before ADHD, and I've had a few. I was called a manic depressive as a kid, and as a young man, I've been on antidepressants and lithium as well. That was horrible. I think my ADHD manifests as wild and rapid cycling of moods, which is that phrase we use, because I respond inappropriately to stimuli, to external stimuli. I respond, my emotions are inappropriate often. My reactions are inappropriate. That is, in fact, ADHD. It's many of us. Lisa, who is my long-suffering wife, she has to tell me about every month or two that, no, I have cycles and I'm not worthless. James, are you allowing that?
I'm struggling, Al, to be honest. So I'm just going to stay quiet for a bit, but I'm enthralled. I am listening.
So she says you just in one of these cycles you go and you'll be bouncing around like Tigger in a few days. And I always say vigorously, you're wrong. I'll be like this forever. And then 2 days later I'm bouncing around. You've been away on a trip with me, James, haven't you? It turns out the way people see me as calm doesn't last very long when you know me. What I would say is that when James and I discuss these things, our peaks and troughs of mood, which we both have quite wildly, I think yours, James, are much deeper and higher than mine, and I don't get the despair as you describe it. I just don't. I just feel not a real human. It's not despair, and I think medically that we might be trying to make diagnostic terms for things that actually exist together and on a scale. I just think that yours needs treating and mine doesn't. We've talked about this before. I'm not telling James something he doesn't know. Yeah. So that's it. I think I have the same things, but it's more likely to be ADHD, but it's the same blooming cycles.
And that's where I do have sympathy for clinicians that have to make these diagnoses, because we're talking about subjective things. You're asked questions about mood and they have to fit a specific criteria. So for example, for dysthymia, it has to be low mood that isn't all the time. It has to be less than a full year, for example. For bipolar disorder, you have to have at least one hypomanic episode in a 12-month period and a number of periods of low mood that last a certain amount of time. And, people often don't recollect exactly when and where they've had these moods. And when it crosses over so much with ADHD, I do have sympathy. Thank you for sharing that, Alex. And that's a genuine thank you. There was nothing sarcastic about that. We've just got time now in part 2 for Alex's favorite game. It's a game that Alex loves. Tell us how much you love this game, Alex.
I mean, I love it. Is it Kaplunk? Because I do love that.
It's not Kaplunk. It's another game of Watch James lost, mislaid, or forgotten this week.
Good.
So tell us a little bit about your enjoyment for that, Al.
I like it.
God, then that was dripping with fakeness. Anyway, it's a phone-related game, Alex. Do you remember the rules?
Yes. No.
There'll be three things I will mention. Two of them will be false or incorrect, and one of them will be something that I actually have lost, mislaid, or forgotten this week, and it's all phone-related. So, option one is: did I lose my phone? Look for it for 25 minutes when it was in my pocket all along. Option two is: have I lost the phone that has our WhatsApp account on it for the charity? And question three is: did I forget to set up the direct debit for my new phone and miss a payment?
Right. So the difficulty is that my new strategy, James, requires me to choose two where I can be horrible to you. You've already planned for this, haven't you? Is this why we're doing this? Is that what? Is the whole thing a setup?
That email was from me.
What a brilliant idea. Well done. Right. So by definition, I have to choose two things to say nicely about you.
Yep.
So I think that you are very committed to our charity, so you wouldn't lose the WhatsApp phone.
It's a fair comment.
I think that you favour very nice dresses, so you don't have pockets, and therefore it's forgot to set up direct debit.
Oh, I'm very disappointed to say that you're wrong, Alex.
Yes.
I have indeed lost the phone that has the charity WhatsApp account on it.
No.
So if anybody's been WhatsApping us, the reason we haven't responded is because I don't know where the phone is.
It's in your house, isn't it, for sure?
Oh yeah, it's in this office. It's in this room, Alex. But as you saw from the picture I sent you earlier, it's not easy to find things in this room.
No, it's not. No.
So your score remains at, what was it?
8 or 9, I think, which is a huge score, isn't it, James?
Sorry, just to clarify, was it 9 or have you just added?
Because I got 2 in a row through new strategy, didn't I?
We'll call it. You know what? We're being nice to each other. We'll call it 9. I'll give 9. You 9, whether it is not. So bad luck, Al, this week. Bad luck, mate.
Mm-hmm.
Really feel for you.
Good game.
Brilliant. That takes us into the break, and we'll be back for the final part of this torturous episode of being nice to each other. Yeah. That is the ADHD Adults Podcast. See you in a bit. Welcome back. In part 3, we talk about, very loosely, top tips. Alex very politely during the break offered me the opportunity to go first. Thank you, Alex. So I will go first. So if you think you have a mood disorder, if you've got issues with low mood, there's first of all, your feelings are valid, and what I would say is that it's incredibly important that you don't hide those feelings, swallow those feelings down, try and ignore those feelings, because that can lead you to a bad place. So try and make sure that you have a support network. Now that network can be one person. If you've got one person that is aware of your mood disorder, or your possible mood disorder, or your bouts of depression or low mood, or your rapidly cycling moods, then use them as a support network. Talk to them, tell them you're in a good place or a bad place. And believe me, if that person cares about you and loves you, as I do for Alex, then they will support you when you have issues that need help. And I know that this is hard, and so much of this is ableist, and I apologize for this in advance, but chase diagnosis and treatment because you deserve it. Don't be fobbed off, or don't be diminished by any healthcare professional that puts some kind of barrier in place. And listen, the reality of this is we're dealing with a healthcare system that's completely fucked and underfunded, and post-COVID is struggling to maintain some of its basic functionality, and mental health services have been systematically defunded over the past 20 years anyway. So I completely understand that this advice is ableist, and I apologize for that. But sometimes you have to push on, and you have to ask, and you have to keep pressing. But you do deserve help. There are lots of online resources that are available. So there are lots of charities like Mind and Rethink that have great resources for you and for your family members and people that support you. So make sure that you use those. You may have triggers for low mood. For me, I generally have a couple, which I'm not going to say because they're personal. But if you know you've got triggers, which you know you can have a bout of low mood or can worsen your mood, try and prepare for or avoid those triggers as best as possible. It's the same for hypomanic episodes. If you're bipolar, if you know that something generally tends to get you into that zone, and believe me, it's seductive hypomania, because for the first day you feel fucking brilliant. You feel like you're Superman, and then all of a sudden it's out of control. But make sure you can prepare as best you can. For periods, this is a really difficult thing to say, but it's advice that I've been given by my psychiatric nurse. If you do have periods of seriously low mood, keep a picture of a loved one in your purse or your wallet and look at it and look at it again, and remember that this will pass. Reach out if things get bad, even if it's reaching out to us. Believe me, there are better people than us.
No.
But reach out.
Yeah,
what about you?
Right here. This sounds sarcastic, James, within the constraints, but I'll just echo everything you said. I'm not going to repeat it. It doesn't need repeating. I'd say talk, especially if it's getting too much, and this too shall pass is simply excellent advice from my friend and colleague. If you've got ADHD but you feel there's more to it, do trust yourself in that. It's worth exploring. It's very common and arguably more likely than some pure ADHD form that probably doesn't really exist. I think the practical tip is get a buddy, get someone to help you. Do not be fobbed off, because it's harder. So if you're on the phone and they say something, you can say, I'm going to go away, digest, and come back if you can, because or have someone there writing notes for you of whether they feel it's appropriate. And I would also add, vote.
Yeah, absolutely. Without wishing to get too political. Mm-hmm. Pay attention to when politicians say how much money is going into the NHS and how much of that is real. The 40 new hospitals, for example, which aren't new hospitals, is a great example of making people feel like an NHS is being funded when it's not. Right. Thank God. That brings us to the end of episode 25 of the ADHD Adults, where we talked about ADHD and mood disorders, where we tried to be nice to each other. And I think we can all agree this will never, ever happen again.
No.
So, as usual, get in touch with us via the socials at ADHD Adult UK if you've got anything you want to say, if there's anything you want to share about this episode or other episodes. And we will see you soon. Goodbye.
Not bad.
Twat.
Bye all.